Too many people didn't pay attention to it. Too many people are writing the medications that probably shouldn't be writing the medications because they're not following it. Too many people will give the first prescription. The patient will return to the office, oh, can I have another prescription? Can I have another prescription? And 5 months down the road, we have someone that's in trouble with narcotics. So it's really turning over those patients quickly to someone that's used to writing the medications. Just like I would never in my practice write for insulin. Don't know how to. In fact, I had a patient today ask me to write for hypertensive medications. And I said, not me. You need to go to your internist. I know your blood pressure's high, but it needs to be addressed with the person that's appropriate. There are plenty of pain management providers in the United States now. We use 80% of the narcotics that are prescribed worldwide, just in our country, and we're only 20% of the patients that actually need them. We are just using them inappropriately, and we need to rein in what's going on in people that are experienced. So it should be the people that are writing the medications. Absolutely. There was a gentleman, Russell Portnoy, who's the president of the American Pain Society, who was the big pain is the fifth vital sign. Pain is, you need more narcotics. Everyone's being undertreated. It should be treated, and started the whole push toward this. He recently recanted all of his statements and said that he was pushed by the drug companies who he's being paid by to start this. And really, before that, it wasn't as big a problem. The money is money. These drugs, you're looking at $400 or $500 a month to get these prescriptions filled, generic or non-generic. So it is a huge amount of money that that companies are making on this. So on some level, we created the problem that way. And if it hadn't been that, right, this wouldn't be the epidemic that it is now. Yes, without question. They're not being turned over to narcotics right away, and they're not getting as many narcotics. So over the course of time, they don't get into trouble being having trouble getting off the medications, as we see here in the United States. There are plenty of patients on a monthly basis that come to my office that are taking a lot of narcotics, and all of a sudden their internist, their surgeon finally says to them, I can't write this anymore, but they're coming to us and, well, how'd you get to here? And it's sort of the same story. Well, 4 was working, then I went to 5, then I went to 6, then I went to 8, then I went to 10. So we get into trouble with the patients at that point, then they get put over to us, and at that point it's much more difficult to get the patient off the narcotics. It's a separate issue, and it's not a separate issue. It's a separate issue in that there are people that are getting prescriptions just for the purpose of selling them. And oxycodone, a 30 milligram oxycodone here on Long Island is about $80 per pill. So getting a prescription where you're taking 4 a day, okay, so that's $240 a day, and you get a month's supply. I mean, you can almost make a salary off of it. There's stories in the newspaper ongoing of before the state put into place the monitoring systems and validating whether patients were taken or not, where a patient would be every day of the week be at a different doctor to get a prescription, get these all filled, and then be selling them on the street for a huge amount of money. So there's a population of patients that are getting this and not taking the medications at all. Those patients are easily picked up by urine tox screens. Mm-hmm. So testing the patient's urine on a monthly basis for anyone that's getting medications that you might suspect that there is an issue will show whether the patient's not only taking the medication, but taking it chronically, meaning you'll see the medication in the urine, but you'll also see the breakdown products. These urine tests have become so specific that you'll be able to see that not only did the patient take a pill recently, but they've been taking it chronically because they're breakdown products of the narcotic in the system. So if you get a urine test and it is only the medication and none of the breakdown products, then you know that they took it just that morning to prove that they had some in. If the breakdown products are there, then you can also see that they've been taking it chronically, so they are taking their medications. And if there's nothing in the urine, then obviously there's a risk that they are diverting the medication. Probably 2 generations out from us, because you still, when you think about it, high school kids now with the heroin, with the narcotics, and so that generation is already sort of gone. So it's sort of their kids that won't be exposed to as much, that there'll be other options, that we might be able to stop the flow of illegal medications into the country, decrease the amount of medications, the prescription medications that are being diverted. But I don't think it will be in the next short period of time.